study it. No, you don't want to go home early. All right, so here's these pictures. I recommend you printing these out while you're studying, because anything that you can visualize to show the blood flow to the heart, where is the blood backing up to? See, the tricuspid valve is in the right side of the heart, mitral valve, bicuspid valve is in the back, the left side of the heart. Just so you visualize where the blood is going, because when it gets into heart failure, if they're right-sided heart failure, that ventricle is not pumping adequately to get blood to the or through the rest to the lungs to the heart. So it's backing up within the body, and vice versa. If the left ventricle is not working, I assume I'm going into heart failure next. We'll find out. So the left ventricle is not working properly. So where's the blood backing up into? The lungs. The left atrium and the left lung. So that's why the left side heart failure always, they have those lung symptoms. They have the crackles, the wheezes, the shortness of breath, they're tired, they're fatigued. So that's why if you just understand the blood flow through the body, it will help you with the symptoms. Here's our preload and afterload again. And then here's our decreased perfusion. So none of these, but these are what you've seen earlier today. So anyone with chest decreased perfusion, impaired gas exchange, we saw this because if we have impaired perfusion, we're going to have impaired gas exchange. So all of these you should know and be able to recognize. So it is going into hospital. I thought so. So heart failure, it's one of the most common cardiac diseases. It's just the heart cannot pump effectively, either the right side or the left side. And sometimes they don't differentiate what side it is, but for us testing purposes, we will need to know the difference between the right side and the left side. I'm not going to ask you like high output heart failure or systolic versus diastolic. Just literally left side versus right side. When we're looking at heart failure, we're looking at ejection fraction. We already talked earlier about 55 to 65 is normal, and they can test the right ventricle and the left ventricle. They're going to see the percentage for both of them, because if you have a left, say you have a left ventricle that's at 30%, that's pretty crappy. But the right ventricle is working at 65%. So the right is like, hey, I'm doing okay, but then that's putting a lot more stress on that left ventricle because it's throwing the blood into the lungs. That blood is coming back to the left side of the heart, but the left side is like, I can't keep up with the right side. So there's complications with that and a lot of medications for that, and just kind of testing, just a lot of testing with the patient and figuring out what medications work for him and for her. So left-sided heart failure, this is our friend Larry, I'll call him because it's left-sided. So he's going to be short of breath. He's going to have cough. He's going to have wheezes, crackles. He's going to have hemoptysis, the bloody sputum, or cyanosis around the lips. Restlessness just because he's not getting any perfusion to the brain. So fatigue, tachycardia, but most of those are all left-sided because the lungs are getting filled up with fluid because of all the backup of blood. Then we have our friend on the, let me go back through this way. Does anyone have any questions on why something would happen here? I don't see it on here, that's okay. So then we have right-sided. So there's no lung problems with her, but she's still fatigued. We have ascites because now the blood is getting backed up into the body. So we're going to have an enlarged liver or enlarged spleen. So they'll have ascites, edema, jugular vein distension, anorexia or GI problems, and weight gain. So you'll need to know the difference between these two. Lab tests for heart failure, these we've already gone over. BUN, creatinine, what is their kidneys? Is the heart failure so severe that their kidneys are not getting perfused? So we're looking at now their BUN and creatinine. The BNP, these are kind of coming in nowadays crazy high. We're just under 100. Used to be normal, but now we're seeing, what was that one we saw the other day with 17,000. I've seen them as high as like 40,000. The heart failure is getting pretty high nowadays. And these are just peptides that are getting released with heart damage also. Diagnostic procedures, we're looking at hemodynamic monitoring, looking at their blood pressure, their heart rate. You can do an echo, look at the ejection fraction, TEE. So we're gonna do a TEE, look at the backside of their heart. What's going on behind the heart? Because you can't really do an ultrasound on the back. So, but that's what that is, a transesophageal. They'll look at the backside of the heart. Chest x-ray, is it enlarged? And then an EKG or ECG, because once someone goes into heart failure, most of the times their heart starts getting enlarged, and when your heart gets enlarged, all those electrical signals get messed up. Those pathways are now in different areas. So that's why a lot of heart failure patients have AFib, just because those electrical signals are not in the same area. Goal of therapy, this is red for a reason. We want to improve the cardiac function. We want to ensure kidney perfusion. We want to increase that gas exchange. We want to decrease the workload of the heart. So that's why we have those medications, the vasodilators, because we want to we don't want the heart to work as hard. Improve contractility, so that's why we give digoxin or dobutamine or dopamine. Those are contractility meds, so we give that heart a little more squeeze. Stabilize condition, delay progression, and promote a healthy lifestyle. I think this is, I don't know if this is available on Blackboard, but something like it is. Just all the meds that you need. Huh? Okay. And then, so here are the meds, why we're giving them, I don't know. But, so afterload reducing agents are ACE inhibitors, ARBs. ACE inhibitors, there's a complication, or not a complication, but a side effect of that is kind of an irritating cough. They might have develop a cough, so the doctor will stop that and put them on ARBs, which is angioreceptor blockers. Calcium channel blockers, just because they vasodilate, they decrease blood pressure. Another side effect of ACE inhibitor is that angioedema, which is on the left side at the bottom left. So we're assessing these and just kind of going through the medications with the patient. Diuretics, they decrease your preload, so we're decreasing that fluid going into that right atrium. So your loop, thiazides, and potassium sparing. So that's why we look at our potassium levels with Lasix, Umix, Diamox. All of those have an X, right, at the end. So they X out your potassium. That's how I remember it. Thiazide is also potassium wasting. Potassium sparing is your aldosterone, prolactalone. Vasodilator, your nitrates. We've already talked about those. Use cautiously because there's a massive vasodilator effect. Increasing contractility, that's your digoxin. So dobutamine, dopamine. Digoxin, like I said, you want to listen to that heart, the apical heart rate for 1 minute, hold if the heart rate's under 60. So and we also want to look at potassium levels with that, because digoxin and potassium, they fight for the same receptor sites on your cells. So if you have hypokalemia, meaning there's not a lot of potassium, the digoxin is going to attack onto those cells. So they're going to say, oh, that's a free site, I'm going to jump onto that. So you might have dig toxicity. If someone has digoxin, we want to look at their if they are experiencing dig toxicity. So this is a medication that we want to know about. But if you have hyperkalemia, that means there's a lot of potassium in your blood, then digoxin's probably not going to work very well because it doesn't have anywhere to jump onto on your cells. So that's why we look at digoxin and your potassium levels together. There is a medical emergency considered for dig toxic levels that's above 2.0. Symptoms of that is they see halos around lights, they might feel dizzy, they might be experiencing bradycardia. And on a side note, if you're looking for adverse effects of medication, think about what that medication does, because guess what? Digoxin lowers the heart rate. If you have too much digoxin, you're going to have bradycardia. So that's why if you're looking at complications with medications, think about what that medication does, and it can probably get you to the complication of it. That's why I said there's a lot of medications with cardia. Other medications, your beta blockers, you know about that already. We already talked about aldactone. I'm not worried about the other two. Education, we already talked about. Weigh themselves every day, the same amount of clothes. Decrease salt intake or have them on a low sodium diet. Check your weight daily. Refrain from smoking. Exercise. I know when I did home health for a while, they would have a calendar on their refrigerator, and they would be writing everything on, they should be writing everything on that calendar. Their weight, blood sugar, blood pressure, whatever they have to do. Just so when the home health nurse went in, but they probably have different communication stuff now, where they can probably enter it in something. Complications from heart failure, short of breath, they're filling up with fluid. Dig toxicity, we talked about it a little bit this last week. If someone's got heart failure or short of breath, space your time out, space out activities so they're not so exhausted, I should say. They don't get fatigued so early. And check those electrolytes. All right, you guys need to wake up. Let's take a little break, get up, walk around.